Since the interception of the administration of President Muhammadu Buhari, the National Lottery Trust Fund, which has Bello Megari as Executive Secretary, CEO, and Honorable Christopher Etta as Chairman Board of Trustee, has been working recklessly and effectively delivering on its mandate. The agency focuses on promoting access to lottery funding for projects that seek to bring succors to Nigerians. The intervention in the health sector on the 33 states in Nigeria and the Federal Capital Territory, FCT Abuja, is their major concern on this era of COVID-19 pandemic.
Members of the diplomatic corps, my lords, spiritual and temporal, gentlemen of the press, distinguished guests, ladies and gentlemen. It is my pleasure to welcome you all on this very important occasion this morning of the official commissioning of COVID-19 medical facilities to select healthcare institutions across the 6 geopolitical zones funded by the National Lottery Trust Fund. I am highly honored and delighted by your presence to mark this significant milestone in the history of national lottery in Nigeria. Distinguished guests, we are about to officially commission and hand over wide-ranging COVID-19 medical facilities, namely test kits, infrared thermometers, rubber N95 face masks, Category 1 personal protective equipment, PPEs, and a fully functional and well-equipped ambulance to some select healthcare centers across the country. This groundbreaking event is the third of its kind on COVID since the outbreak of the pandemic in the country. It could be recalled we were in General Hospital Daura in Katsina State in April this year at the heat of the pandemic to commission and hand over a well-equipped and rehabilitated COVID-19 intensive care unit to the state government. Similarly, having taken note of the post-traumatic impact and mental disorders faced by patients of coronavirus, the agency, in collaboration with the Federal Ministry of Special Duties and Intergovernmental Affairs and Sunshine Wellness, an NGO, set up a psychosocial treatment outpost to deal with these challenges. These projects, I believe, and over 40 interventions undertaken by the Trust Fund in health in the last few months is commendable. The essence of this intervention, Your Excellencies, distinguished guests, is to support our healthcare institutions to curtail the spread of the coronavirus in the hope that this effort will make all the difference in saving lives and enhancing the capacity of these institutions to provide high standards of care to patients, as well as protection to frontline healthcare professionals.
Distinguished ladies and gentlemen, my special thanks go to the Minister of Special Duties and Intergovernmental Affairs and his team in the ministry for joining the Presidential Task Force to fight the scourge of the virus, especially at this critical moment when the epidemic is resurging and shutting down economies across the globe. I'm confident this intervention will go a long way in providing effective and safe treatment for patients and enforce our detection mechanisms already in place as well as protect our healthcare professionals. The need for collaborative effort against this pandemic cannot be overstated in light of the new developments across jurisdictions globally. As PTF continues to evaluate the developments as well as the level of compliance nationwide, it is of concern that many Nigerians, irrespective of status and creed and level of education, still ignore the basics for good hygiene, breach of the protocol of the guidelines, and the non-pharmaceutical measures that have been put in place. The COVID-19 remains very virulent and a dangerous pandemic, and the World Health Organization statistics show that more cases of COVID-19 have been reported in the past 4 weeks than in the first 6 months of the pandemic, meaning that the caseload is on the increase and is increasing what we say exponentially. And 2 plus 2 is 4, 4 times 4 is 16, 16 times 16. If you go on calculating, you know that that is why we have 59,002,158 confirmed cases as at the 23rd of November, and 1,382,106 deaths across the world. These records are evidence of the spike in daily numbers and represent a red flag for all nations, including ours. Now, analysis shows that people over the age of 50, especially those with pre-existing conditions like diabetes, hypertension, and so on, are most at risk. And that is the reason why over 60% of the fatalities we have seen so far are people over the age of 50 or 60, despite the fact that they make up less than 20% of the population. So the need to appeal to all Nigerians to restate their behavior and comply more with the guidelines that are in place, to avoid large gatherings and observe all the measures will help to flatten the curve in the country. We will continue to strengthen our risk communication and develop messages aimed at resonating with the various demographic groups of the country, stressing the common thread in the message for compliance and the proper meaning of face masks and coverings in public spaces. Ladies and gentlemen, it is my pleasure to inform you that the PTF is making steady progress in securing vaccines for the country in partnership with multilateral organizations like the World Health Organization. Our hopes are brightened in ending the pandemic as human trials on the efficacy of the vaccines developed by top-flight pharmaceutical companies are beginning to show positive outcomes. I would like to reassure all citizens that President Muhammadu Buhari administration will continue with vigor the sourcing of vaccines for use to immunize citizens of Nigeria. This is critical in view of the need to reopen the economy for continued growth and to avoid recession, which has hit nearly all countries in the world. This government is working hard to put the economy back on track, even with the devastating impact of the COVID-19 on the economy. Honorable Minister, distinguished guests, on behalf of the government of Nigeria, I now hereby formally receive the medical supplies and the commodities for the benefit of humanity and for the good of Nigerians.
Virus. I'm particularly happy to take part in this ceremony because the promotion of quality healthcare is a cause close to the heart of President Muhammadu Buhari, as this constitutes one of the main objectives of peace administration. I therefore commend the effort of the board, the executive secretary, and the entire management of the National Trust Fund for their total sense of involvement and commitment to good causes. Despite the COVID-19 outbreak since March and the negative impact on our economy and indeed global economy, the fund has remained resolute in funding worthy projects with very meager income available to it. It is on record that the agency has improved over 40 healthcare centers across the country within the last 2 years, putting smiles on the faces of Nigerians. The fund has also extended this gesture to the fight against coronavirus pandemic. As we were told, each time the medical equipment is donated, it helps doctors in making incremental and steady progress and breakthroughs towards efficient service delivery. The first successful separation of conjoined twins in Nigeria, conducted by the Federal Medical Center Yola a few months ago. That's first in Yola area. Is partly attributed to the world-class radiology equipment donated to the hospital by the National Lottery Trust Fund. This is highly commendable, and I urge the agency to continue in this direction. I have said first in that area, not in Nigeria. Distinguished guests, ladies and gentlemen, it is evidently clear the proceeds from lottery and other revenue sources are capable of revamping our healthcare sector and invariably improving health service delivery in the country. Government will therefore continue to support the trust fund to promote the nation's medical and health industry, targeting to improve the social and health well-being of the Nigerian people. At the same time, government will also direct the realization of the full monitoring and evaluation of the processes to assist the agency to keep track of the utilization of the facilities so that project outcomes and research for the intervention programs are delivered for the benefit of Nigerians. Distinguished Nigerians, lottery has been identified as a wealth generator with impact on economic growth across jurisdictions globally. The industry in Nigeria is not set to getting its own share of this fortune, as can be confirmed from the previous numerous intervention programs across sectors undertaken by the Trust Fund. With a population of over 200 million people, and the largest economy in Africa, government will ensure the reactivation of this industry that holds great potentials for Nigeria in raising our revenues and creating job opportunities for our youth. I am certain that this would help to actualize President Muhammadu Buhari-led government promise to lift 100 million.